Good afternoon, and thank you all for joining today the Therapeutics I-Factor Peptide Enhanced Bone Graft Reimbursement Support Program Overview. I am Carolyn Newman. I work for MCRA, who is providing the support program for the I-Factor on behalf of Therapeutics. In today's webinar, we'll discuss some of the program elements, how to access it, and how the reimbursement programs can assist you in the field with coverage and coding for your cases. So to begin, just a little bit about who MCRA is. MCRA, M-C-R-A, stands for Musculoskeletal Clinical Regulatory Advisors. We won't ask you to say that, and we rarely do as well. We provide best-in-class services in reimbursement as well as regulatory, clinical research organization, compliance, and quality assurance. So MCRA has been in business for almost 14 years. We specialize in neuromusculoskeletal biologics, orthopedics, and device manufacturing industry in general. A group of reimbursement experienced professionals. We provide everything from the services I'm going to explain and talk about today to analyses, health economic papers, and various other elements of the reimbursement landscape out there. Just a brief overview of today's presentation. First and foremost, Reimbursement Resource Center, just an overview of it. What am I talking about when I say Reimbursement Resource Center? The services that are available through that resource center, what is our coverage access service about, our pre-authorization services, how to onboard the pre-authorization services for your cases, some best practices for implementing the program, expectations, a very important piece of this is to understand the expectations of the program in terms of coverage and how we move forward with cases on your behalf. And then how do you access us and our resources? At the bottom of the page and several of the pages, you'll see that there's a toll-free phone number available, 1-800-361-0795 for those of you who might not have the visual. And also we can be reached directly at therapeutics@mcra.com. The overview of our program, we are a live touch communication program. And by that we mean we don't have phone queues. We respond promptly, real time, a real person. Our phones are manned by credentialed coders. Our coverage access team is available on site. We are very dedicated to customer service in making that the process of accessing our services simple and pleasant for your providers and your practices. So why would you contact us, or why would your practice contact the Reimbursement Support Center? For real-world billing and coding, as well as coverage access or pre-authorization services. Again, credentialed coders, orthospine experience. We also provide access to comprehensive resource guides, and I'll discuss what that is and how that is helpful as well. And we're truly dedicated to meeting your coverage access needs as well as the patient's needs for access to quality care that's indicated by the physician. So for all Therapeutics I-Factor cases, what's available? Full service coding support, case benefits verification, and pre-authorization, as well as pre-authorization denial appeals. There's easy access for your practice. Office just calls, and we do the rest. So part of the service is explaining the service to people. Initial onboarding, there's sometimes not a misunderstanding, but a lack of understanding of what we can do. We know that, and we talk people through. How can we help? What can we do? What's the process like? So it isn't scary at all. We put that out there right at the beginning, so we begin to build a relationship with the practice that's a very important part of our service. As you know, out there in the field, that relationship is probably primary in most situations to any success. Again, the comprehensive iFactor reimbursement resource is, the resource guide is available for anyone's use. The resource guide is not just a billing guide. It contains billing codes and some of the basics about coding. However, it also has a much deeper dive into the process of pre-authorization, the process of pre-authorization denial appeals when that happens, and templated letters that can help a practice if they want to do a pre-authorization on their own, they just want the technology information, and links to policy, other ideas that help with the entire process of pre-authorization, coding, and reimbursement as a whole. So it's a guide that can provide a lot of essentially value to the practice. Additionally, there's benefits verification is provided for all carriers. So every case that comes to us, we provide full benefits verification. Why does that matter? In the world of large deductibles, high deductible plans, it's very important for a practice to know where a patient stands in that if they're considering a surgical procedure. And validating that the patient actually has the insurance they say they do, where do they stand in terms of the cost and what the patient would be liable for, and the impacts that even may have on the facility level. So that's the first step. That's something that we can do for your practices. And then case-specific pre-authorization. Should the pre-authorization need to be denied or is denied by the insurance company and then needs to be appealed, we work through those appeals. All the way along, we work side by side with the practice so that they're fully aware of what's going on, that we don't start one day and then 5 days later tell them yay or nay. We work with them. Our main goal is to save them time and energy and angst. It's the processes that insurance companies put up, the hurdles that they put up to get cases pre-authorized now are more difficult every day. And that can be a difficult situation or a new technology that just is a little bit different, can make the workload in a practice just triple a zillion times over. So that's one of the parts where we will work with them, but our goal is to make this easier for them and to help them with our expertise to obtain coverage access for their patients. So one of the things, I think I might have skipped a slide. Nope, I guess not. One of the things that's really available to your practices at any time of day through the Therapeutics website is a booking tool for reimbursement discussion. As I said, we have the dedicated toll-free number, the email address, but also the practices can access our call center and our services by going to the Therapeutics website. That's pretty straightforward. You'll see circled the reimbursement tab, going to the reimbursement tab, and then there is an online booking tool. And this is something that can provide access to us at their convenience. Essentially, the booking tool, they sign up, click to book now. They're actually provided with the free billing guide at that point about therapeutics and iFactor. And then they can move on to a screen where they schedule a call with us. So in a practice, and many of us here at MCRA have been practice managers, have worked in practices for varying periods of time. Time is critical. Having the time to really even reach out to some service like ours or program like ours, finding that time is difficult. This is one way to have a practice get in touch with us when it's convenient for them. So they pick the day and they pick the time, and we call them back. And so this is a very compliant way for them to reach out to us. Typically, reaching out for reimbursement purposes, you know, is not a positive thing in the way of compliance. But when they ask or they call us, that's when the service becomes a real value to them. So why would you need this coverage access? First and foremost, spine is difficult in every way as far as getting a pre-authorization. That changed the last 5 years. It's just every time we look at any new situation, the policies change. The process with individual insurance companies has gotten more complicated, bigger forms to fill out, and getting the communication appropriately over to the insurance company when you're asking for a pre-authorization has become difficult and time-consuming for the practice. So typically what can happen is something that's difficult 2 or 3 times in a row, a new technology, a spine procedure that is a little tiny bit different from the norm, it reduces that ability to or willingness to take that on. And so the service that we provide to the practice is in hopes of relieving some of that. I already talked a bit about the fact that the pre-authorization and denial appeal saves the practice time. And if anyone listening has ever actually processed these and worked with an insurance company, they do have queues, phone queues. It takes hours sometimes to find your way through. We've perfected or gotten close to perfection on how to make that as simple as possible. And your pre-authorization people in a practice will know that as well. But one of the things that might be a little more difficult, they've probably figured out the insurance companies they work with. However, they need the technology details. And so submitting the right data about I-factor and about the spinal procedures that are going to be performed or been indicated by the surgeon, that has to be communicated appropriately. So good communication. Many insurance company reviewers will be confused if you just imagine how many cases they have to review and all the different elements of them. So good communication, appropriate technology details, saving the practice time, and exhausting all options. I mentioned that the process for pre-authorization and pre-authorization denial appeal, it's not simple. It takes many steps. You have to follow it precisely. And at some point, practices run out of time to do that for their patient. And we'll talk a little bit more about expectations in that element of it a little later on. But getting the patient access to treatment that's indicated, the best treatment indicated by the physician, may involve exhausting a first-level appeal, a second-level appeal, and maybe even following through to an external appeal, which is based on medical necessity. So the Therapeutics Coverage Access Program is obviously physicians and facilities should contact us directly for support. The Comprehensive Reimbursement Resource Guide and the Billing Guide will be shared about I-factor and procedures that are related to the I-factor. Within this, the Coverage Access Program or the Pre-Authorization Program, the hours of operation, just for convenience, Monday through Friday, 8:30 to 5. The actual coding hotline and call center is 8:30 to 7 p.m. Monday through Friday. These are all Eastern times if you're in a different time zone. The booking tool is available 24/7. So that can be a real added bonus to someone who's just pushed for time, knows that maybe next Thursday at 2 o'clock is going to be a quiet, the surgeon's out of town or something like that, and they want to talk with us, they want to find out about the program, they want to get the resources, and they want to start the process of being able to bring cases to us. That's a great first step, that booking tool on the reimbursement page or tab of the Therapeutics website. So let's walk through a case, I-factor case. Obviously, a MCRA introduction, and this is a piece that becomes a sort of a second sales job, and we don't like to mention sales and reimbursement in the same sentence. But the reality is that the surgeon has indicated that a patient is appropriate for this procedure and this device, or we'll call it a device for now. However, the office staff needs to understand that the program exists and why it would be helpful, and that we can be trusted. And building that relationship is as important as you understanding what the programs provide, so that they're comfortable using it and realize how much time and effort and expertise we can really provide, time savings. So one of the things that compliance requires is that a business associate agreement be established between MCRA and the practice. I'll talk a little bit more about that, but the main reason for that is to protect the patient's information that practice is responsible for. Essentially, we're signing it, they're signing it, saying that they're HIPAA compliant, we're HIPAA compliant, and we respect and treat that health information appropriately. So one-time agreement, most practices are very familiar with it. I'll go in a little more detail in a minute. So the practice calls us on a toll-free number or perhaps emails or uses the booking tool, but contacts us, gets in contact with us for pre-authorizations. We walk them through the process. There's a simple intake form. We also can address coding questions at the same time, different times, credentialed coders, and as we laid out before, simple intake form, benefits are verified right away. That's usually a 1 or maybe 2 hours to turn around, so they can get that information right then and there. And then beginning the case pre-authorization, we do the submission. We we work alongside the office because they have that information, and we don't want to be doing things that they're not aware of, but we also want to take that time burden away from them and work through the pre-authorization, respond back to them if there's a denial. If there's not a denial, we respond back and say, hey, it's pre-authorized, and that's the best case scenario. We regularly update the practice on the case status. So that information, anything that's protected health patient information, stays between MCRA and the practice, and that is for compliance and safety, and everyone wants to be comfortable that that's happening. There's a lot of reasons to remain compliant in this day and age in terms of patient information. So to onboard the MCRA services, 4 steps. First and foremost, there's the engagement. And this is where the rep, the field, needs to share the program basics, the sort of second sales, as I call it. The program needs to be identified, contact information shared, what do we do, what don't we do, and just get this connection made. They engage with the reps engage with the practice, and then the provider pre-authorization program process and contacts for MCRA are shared. Secondly, the practice calls, or the surgeon's office, either, and I mentioned call, but email is perfectly fine, and the booking tool is perfectly fine. What we need is a direct connect from the practice saying they're interested in learning about this program, they're interested in perhaps pre-authorization, or I have a coding question and I need to ask you about that. So the surgeon's office or the practice contacts MCRA directly. The third piece is we respond with education. We respond with the intake form. We work through the business associate agreement. It's a one-time signature, explaining that if necessary. And then in the end, we keep the practice informed. So MCRA manages that pre-authorization from start to finish, keeping the practice informed. One of the things to remember is the practice can bring us a case at any level. There are practices that we work with who want to do a pre-auth themselves. They want to do that initial piece. Once there's a denial, they engage us for that case. Sometimes they've done an appeal and they want to go forward with the second appeal. And as you'll see, we're going to talk about some of the time frames. This is where things really becomes a time saving if the patient and the doctor are committed and want to wait through this external appeal process. The offices are always thrilled to have us support them in that way. So the business associate agreement, this is a big question that comes up, and we don't want it to be an issue. We're adept at explaining what it is, but oftentimes an office will wonder. It's HIPAA related, so it is to protect private information of the patient, and it's really the practice who wants to have this agreement. There's no, and so unfortunately they call it an agreement, and sometimes people think there's some kind of business, being done between us and the practice. No business at all in terms of, payments or anything like that. It is just because the practice is responsible for only sharing their patients' information with appropriate people. We are assuring them we are HIPAA compliant, that we protect that information. Again, only sign this once. Once the practice is on board, then it lasts forever. It can be signed by anybody in authority. It does not have to be signed necessarily by the surgeon. Depending on the practice setup and how it's organized, different people have authority to sign it. So some of the best practices to consider for a successful program implementation is if the program isn't implemented, it can't be helpful. We're very dedicated and we want this to work, but there's involvement on all three levels. There's MCRA understanding, there's the therapeutics, sales and marketing team that are sharing the information, being engaged, and then engaging that practice so that they find the true value in having these programs. Level setting patient and provider expectations. We don't have magic at MCRA, and I say that right out because that should never be represented. The insurance company has the final say, or the state insurance commissioner, if you go all the way through the appeal process. MCRA cannot change that. The expectation for the patient to understand that it may take time to go through this process, and the surgeon needs to understand that as well, that if you give up right away, you will never know. And it seems to me that these things are extracted further and further many times in terms of the process. Sometimes the approval comes very quickly, and that's really great. Other times, it may require several appeals. And this can be the same insurance company, even in the same practice, because plans, you say United Healthcare, but there are probably 200 different plans nationwide with different policies and different processes. Every state has different rules. So we try not to generalize, try to understand that the level setting the patient, the provider's expectations will be the best way for them to access coverage. Assume that the insurance company knows nothing about the technology and the treatments that are being pre-authorized. And that's not an easy statement to say, but it's probably true most of the time. So the initial review, or the person doing that pre-authorization, is not going to understand all the technology differences. They're just doing check boxes. So a lot of pre-authorizations are denied. I've always thought there's two piles, and at the end of the day, they just start putting it in the no bin. I'm sure that's not true, but it feels that way. So making sure you go through the exhausting all options is an important step. Communicating the technology details, I mentioned that before. We have those details we can share. We can put them in the pre-authorization letters so that the communication is appropriate about the technology. Understanding the importance of the appeals, going through exhaustion. And lastly, best practice, understanding or being cognizant of internal office policies and responsibilities. So how does this factor in? It's about the relationship piece. There may be, every office, every practice, every business entity has office politics, where someone may feel their job is threatened, or someone maybe has not been completely upfront with the surgeon about something such as pre-authorizations. And they may feel even threatened by an outside service, or they may have experienced an outside service that didn't know what they were doing. And so getting into that environment and building the trust that MCRA is here for only one reason. It's to make it easier, make the outcomes better, and work towards coverage access for their patients is going to, in some cases, take some time. There may be someone sitting there who thinks their job is on the line. They haven't been getting any pre-authorizations for particular types of spine procedures, always getting no's, and they've been telling the doctor, oh, no one covers that anymore. They may not be willing or wanting to share with someone who may, have a better chance at that or do a better job. Or we've seen a lot of times where surgeons are not told the truth. They may be told, oh, I called MCRA and they didn't answer the phone. If that happens, and that really does happen, I want to know about it. We want to know about it. We're here the hours that we say we're going to be here, and with the booking tool, that's a responsibility that we take very seriously as well. So you never know what's going to go on. Just be cognizant of it. In many practices, there won't be any of this. They'll be thrilled to be helped. Others, you never know what the real reasoning is behind their decisions. So what are some of those expectations about coverage and pre-authorization? Typically, pre-authorization can take 5 to 10 days, and everyone likes to generalize and know specifically. It's plan specific, state regulation specific, and insurance company specific. So there can be many levels of, like I said, it can be one. Cigna plan can take 2 days, and the other Cigna plan takes 10 days, and that's by their guidelines and their regulations. If there needs to be a denial appeal, it could take anywhere from 10 to 30 days, and this is a broad generalization, but setting that expectation is important so that the patient is aware that, depending on the insurance company and depending on how pre-auth goes, this could take a bit of time. There are multiple levels of appeals are possible with most all plans. Sometimes we'll find it hard to find within the plan what the next step is. We'll figure that out. And then insurance company ultimately determines the timeline. And that can be very frustrating because why is someone else controlling my health care, and why a doctor has it scheduled for 3 days from now? We've got to fit it in that time. If an insurance company doesn't want to expedite it, and we do try to expedite things when necessary, it is in their control to say yes or no for a pre-authorization. So in summary, the Coverage Access Program seeks to expedite insurance coverage, obviously, and appeals, and this drives patient access to appropriate treatment. We remind ourselves of this here. Working with insurance companies on a daily basis is tough business, and when we get what we call a win, we're very happy to say we've helped the patient get appropriate treatment. That's what drives all of us forward, and you share that as well, I'm sure. Final approval is case and plan specific. I think I beat that one to death. The Coverage Access Program facilitates the pre-authorization and appeal by submitting the appropriate data. And I can't really stress that about a new technology. There are so many confusions in insurance companies. Names are similar, indications are similar or different. Things get lumped together with a no, and explaining that appropriately is sometimes the key to success. Also, tracking case requests, identifying trends and denial evidence patterns, that is a benefit also of cases being submitted through MCRA. And then MCRA manages, of course, the stages of pre-authorization from beginning to end and exhausting all options. centralized process for assessing all the services. So it should be simple, either a phone number, a email, or the booking tool where we will call them back at their convenience, all coming through one central point. We distribute or triage the calls, and depending on if someone's asking about coding, the coding can be answered real time. All the people that answer the phone are credentialed coders. For the case intake, our coverage access team is basically, we're sitting right in the same cubicles area, and it transferred right over. So I can't emphasize that piece of it and the not having to wait, because that really drives the practices crazy if we can't do something quicker than they can. So be assured that we make a lot out of that. Credentialed coders, access to the reimbursement resource guide and the billing guide. These are tools that a practice can use if they're not sure that they want someone else doing their pre-authorizations. They want to engage and just have the resource guide available to them, so they have the templated letters, they have the technology descriptions. Maybe they want to do the initial pre-authorization. Maybe they need to do a denial appeal. All that information is available just by calling or emailing us. Remember that the secure HIPAA-compliant handling, that is an important aspect to get across to the practice so that they're comfortable with us. They're responsible for that, and we take that very seriously. Process and assistance and support is provided at all steps. There should be no fear of calling if you really don't even know why you're calling, and that does happen. What is it you can do for me? Can you help me with this? What can you provide? Those are questions that we handle very comfortably, because the program only works if the practice begins to trust us and know that we're there for them, not trying to make their life more difficult in any way. So just some of the basics. I'll leave the screen up for just a minute. Of the toll-free number, 800-361-0795, or email therapeutics@MCRA.com. One access point, the booking tool on the Therapeutics website under the reimbursement tab. Don't forget that. And the coding hotline service, 8:30 to 7 Eastern Time, weekdays, and anyone can call. Physicians, practices, facility managers, surgery centers, hospitals. And at times we do get many calls from hospitals or surgery centers looking for particular codes. All procedures need coding, whether it's the physician's office in the practice or whether it's a facility. And then the coverage access program for iFactor, again, benefits verification, pre-authorization, distribution of resources, and we'll help you through to understand what's going on. Thank you from the MCRA reimbursement team. It's been a pleasure explaining an overview of the program. We are always here for you to call if you have questions, if you're concerned some of this didn't sink in or some of it was a little bit confusing. I'm always here. You can ask for me, Carolyn Newman. Call the hotline number. Ask for me. Actually, all the associates are well-versed in explaining to you as well, how the program works and how we're going to kick this off the ground. So I put together a few commonly asked questions, because there's always questions. And again, feel free to call and ask your own questions, but some things that are posed to us and we can answer. So can I, the rep or the sales agent, call MCRA to initiate an iFactor case and pre-authorization? Understand that for compliance reasons, the practice must make initial contact with us directly. There's 3 ways to do that. there's, phone call, booking tool, email. Also, you can do what's called a warm handoff, which would be if you're with the practice manager or the surgeon, whoever wants to call us, or you're telling them about the program, you can be in the room, you can dial the number, but the office needs to talk with us so that there's no inducement or any type of non-compliant interaction. Once that's established, then we build the relationship with the practice. So hopefully there's at least 4 ways that you can get them to connect with us, and be sure that they do, because it's pretty easy for a practice to say, oh, sure, I'll call them later, and then that never happens. And then cases don't go through, or you're just told, well, I can't ever get that covered. Another question, can we ask you to call the doctor or practice to get them started? So if the question being, can you, the rep, call MCRA and say, please call Dr. So-and-so? That also runs into a compliance issue. The easiest way to get around that is to use the booking tool and have a call set up by the doctor, by the practice, with us at a certain time. How does the practice know the status of a case in pre-authorization if we cannot tell them? Okay, so this is a question. Reps want to know what's going on. And if you go in about a case and you want to know the status so that you can tell them, be assured that we will be in touch with them and they will know the status, because it's that 3-way interaction that borders on non-compliant. If it deals with any specific case and protected health information, we don't share that with therapeutics directly, not individual case information. But we are in direct contact with the office every step of the way. And we gauge this because some practices don't want you calling every day. And we ask, how often do you want us to update you on the status of this case? We call every day on cases. If something is out into external appeal, we'll tell the practice the intervals for that we'll contact them. But we also don't want to be obnoxious and waste their time, because if they have to talk to us every 5 minutes, that's a waste of time for them. And another question, does therapeutics receive reporting metrics about the case pre-authorization outcomes? So the answer here is yes, they do. Again, considering compliance is an important piece of it, and the reporting back to therapeutics is in aggregated form. And what does that mean? It means we don't share the specific protected health information about each case. And there's some very, very detailed HIPAA rules that govern that. But we do share reports in the aggregated form with the therapeutics management team on a regular basis. These come in the form of cumulative case reports by surgeon, cumulative case reports by insurance company, and then also we provide them with a quick look dashboard each month. So over time, as cases build up, that dashboard can be very telling, showing the number of cases in which state or which surgeon or what insurance companies, so that that can be utilized by the management team at their discretion, and how they share that is their discretion. But important to remember that if you call us and you say, can you tell me about, Sam's case with Dr. Smith, what level of appeal and what are the objections, that isn't going to happen. And that's just an expectation we want out there so that there's no hurt feelings. We do everything we can to share as much compliant information back with therapeutics as possible. So with that, I will say thank you again. Thank you for joining. Thank you for listening. And we wish you great success and success with the program. Again, call the number. You can ask for Carolyn. More than willing to talk through the program with you and work this to everyone's advantage, and particularly the patients. It's been a pleasure. We'll talk again soon. Take care.